Welcome to the Explainer. Today, we're taking an intense, deep dive into what it literally takes to become a fully qualified orthopedic surgeon. We're basing our whole journey today directly on the official Taiwanese orthopedic surgeon training curriculum guidelines. Specifically, we're looking at document number 06-114. This document lays out a totally grueling, highly structured curriculum, and we're going to unpack exactly what these doctors have to survive before they're ever allowed to operate on you. Okay, let's jump right in. 54. That is the magic number here. We're talking 54 months, or 4.5 years. That's a massive, totally non-negotiable time commitment required just to complete this specific specialty training. And remember, this isn't medical school. No, this is the intensive, specialized training that happens after the medical foundation has already been laid. It's a true marathon, guys.
Here's a quick look at our agenda for today. 1. Overview of orthopedic training. 2. The first 6 months, building the foundation. 3. Months 7 through 54, the clinical gauntlet. 4. Specialized rotations, treating what you know. And finally, 5. Evaluation, proving you're ready.
Section 1. Overview of orthopedic training.
So the official 4.5-year timeline is strictly divided into 2 distinct phases. You see, you don't just walk in on day 1 and start doing knee replacements. Obviously. Instead, there's an initial 6-month preparatory phase dedicated entirely to foundational skills. Only after surviving that do residents enter a massive, relentlessly scheduled 48-month clinical rotation block.
Section 2. The first 6 months, building the foundation.
Right out of the gate, the curriculum demands a pretty intense, diverse baseline of skills. I mean, residents have to master fundamental patient care, radiation safety, because they're going to be working with x-rays constantly, right? And clinical communication. They also have to do a deep dive into pharmacology, specifically learning how to manage drugs for patients with compromised liver or kidney functions. And to top it all off, they must pass an advanced CPR certification exam. Oh, actually, wait, there's more. They're also required to write at least 4 detailed case reports every single month.
When we look directly at the original curriculum document, it officially mandates that residents regularly participate in specialized case conferences, things like clinical pathological conferences. And they aren't just sitting in the back taking notes either. They are required to present. This is deliberately designed to build up their organizational skills and give them vital public speaking and case defense experience right from the very start.
Now, you might be wondering, what's the big picture here? Well, the crucial point is this overarching philosophy embedded in the guidelines, holistic medical care. Even though these doctors are training to be bone and joint specialists, the curriculum explicitly states that treatment has to start from a macro-systemic perspective. They are literally trained to see the entire human being, not just a broken arm or a fractured hip. It's all about grounding the doctor as a human first.
Moving on to Section 3, months 7 through 54, the clinical gauntlet. Over these remaining 4 years, a resident's life is intensely, and I mean intensely compartmentalized into 7 specific subspecialties. They spend 9 months on general orthopedics, another 9 on trauma, and then they do these 6-month blocks each on joint reconstruction, pediatric orthopedics, hand and foot, spine surgery, and finally, sports medicine. As you'll see, the curriculum's strategic pacing deliberately places the heaviest initial emphasis on general orthopedics and trauma, taking up a combined 18 months, a year and a half. These 2 areas form the absolute core of an orthopedic surgeon's diagnostic and emergency response capabilities before they ever go on to refine their skills in smaller niches. And the whiplash between these rotations is just incredible. I mean, contrast the trauma rotation with pediatric orthopedics. In trauma, they're dealing with the high-stakes, life-or-death chaos of mass casualties, complex open fractures, and amputations. It's wild. Then they suddenly pivot to pediatric orthopedics, which requires delicate, developmental precision. They're treating things like hip dysplasia in infants, analyzing walking gaits, and managing the orthopedic impacts of cerebral palsy. It requires a completely different mindset.
Section 4. Specialized rotations. Treating what you know.
Think about the common everyday ailments listed here. Trigger finger, carpal tunnel, tennis elbow, ACL tears from playing weekend sports, or, a frozen shoulder. These are the exact issues doctors spend an entire year mastering during their hand and foot and sports medicine rotations. They learn absolutely everything from localized steroid injections to complex ligament reconstructions and arthroscopic surgeries.
Furthermore, the joint reconstruction and spine surgery rotations prepare these doctors for our aging population.
Here, they master the really complex structural interventions that give people their mobility back. We're talking total knee and hip replacements, correcting spinal deformities like scoliosis, and utilizing cutting-edge, minimally invasive endoscopic spine surgeries. It's high-tech, high-impact medicine for sure.
And finally, Section 5, Evaluation, Proving You're Ready. So the assessment process is rigorous and incredibly active. It is definitely not just some written test. Step 1 involves constant clinical supervision, which is tracked by a learning passport. Then, Step 2 literally forces residents into the hot seat. They must present complex cases, including complications and mortality cases, at department meetings. Finally, Step 3 requires them to actually contribute to the field by presenting oral and poster papers at major orthopedic conferences. They go from being heavily supervised to publicly defending their own medical findings.
Well, we've walked through the 54-month marathon, from foundational CPR all the way to complex spine surgery. And it really leaves me with this thought. Next time you visit an orthopedist for a sprained ankle or a stiff shoulder, how is your view of their expertise going to change? Especially knowing the incredible gauntlet they had to survive just to walk into that exam room with you. Thank you so much for joining me on this explainer, and keep learning.